Hello, my name is Thomas, and this is my week 3 remediation video. I have completed 150 questions on Kaplan and my 30 questions on UWorld, and I have reviewed all of my missing questions. So my top 3 questions are, the first one will be based off a Kaplan case study, and well, all 3 of them are case studies. The specific one is about finding specific clinical findings for each disease process. And in this case, it would be cataracts, muscular degeneration, and open angle glaucoma. And the clinical findings were blurred vision, photosensitivity, halos around lights, tunnel vision, blindness, and reduced central vision. So I believe that at the moment, I thought cataracts could cause blurred vision and did could lead to blindness and reduced central vision. And for muscular degeneration, it would be blurred vision, photosensitivity, tunnel vision, and then just blindness, and then open angle glaucoma. Blurred vision, halos around the lights, tunnel vision, blindness, and reduced central vision. So after doing the remediation, it tells you that cataract symptoms include just blurred vision, photosensitivity, halos around the lights, and difficult seeing at night. And it could also be said that your vision can be cloudy. And then for muscular degenerations, its symptoms include blurred vision and reduced central vision. And open angle glaucoma include blurred vision, disordered vision, and tunnel vision. And both glaucoma and macular degeneration can result in complete vision and blindness, unlike cataracts. The next case study will be based off the pass point exam that we did, and it's the same concept of finding specific clinical findings for each disease process. And the 2 disease processes include acute myocardial infarction and an acute stress response. And the clinical findings were chest pain, shortness of breath, dilated pupils, elevated blood pressure, rapid pulse, rapid respiration, nausea, and a stressful event. So I believe that they were mostly the same. The only thing that I knew, an MI wouldn't have dilated pupils, but I thought it would appear in stressful events because I always imagine that patients will have that feeling of chest pain when just having difficulty. And yeah, also like stressful event, I always think of like exercise, and I know MIs can be caused by that. So the correct answers were both MI and acute stress responses show chest pain, shortness of breath, elevated blood pressure, rapid pulse, rapid respiration, and nausea. But an acute stress response also includes dilated pupils and can only be caused in a stressful event. So that's one thing that I learned. And then the other case study was about the difference between, I'm sorry, I'm trying to find it, delirium, stroke, and dementia. So yeah, those were the 3 disease process, and the assessment findings were acute onset, change in mental status, hallucinations, and inability to converse. So I knew the acute onset would be both delirium and a stroke. Dementia, it's a chronic disease and it usually progresses. So I knew it wouldn't be just acute. Change in mental status, I thought it was all three, and that was correct. And in hallucinations, I thought it was all three as well, because um, stroke, I believe, like you could have like I thought your mental status wouldn't be there and you could see things or hear things. Same with dementia. I always thought people will like think that their aunt or uncle or family members were near them, but they weren't. But it showed that it was only hallucinations are only in delirium strokes, and inability to track in conversation. Um, I thought it was for all of them, and it was for all of them. But it was the only thing that was different was the hallucination ones. It does not show up in dementia. Um, yes, and those were the main questions. I believe I need to work on is just finding, mostly for the next gen questions, is like finding or understanding the specific clinical aspects of each disease process, and yes, and like trying to differentiate it between different ones that are like similar to each other. Okay, thank you.